Welcome to Prevention is Now. My name is Deb Bonner, and I am the Preventionist and Community Advocate for Prairie Center Against Sexual Assault in Springfield, Illinois. Now, if there were a public health issue that affected millions of people in every walk of life, women, transgender and non-binary individuals, and men of every race, ethnicity, and age, and had lifelong implications, you would want to do everything in your power to prevent that issue. Well, that is exactly how the Centers for Disease Control and Prevention describes sexual violence. Unfortunately, sexual violence does not have a simple cure. Prevention efforts need to reach across the entire socio-ecological model, starting with the individual level and expanding into relationship, community, and societal levels. It involves promoting positive social norms, teaching skills to prevent sexual violence, and creating protective environments, as outlined by the CDC's Stop SV, a technical package to prevent sexual violence. It is a daunting task and often requires a variety of prevention efforts to truly be successful. To discuss with us exactly what sexual violence is and some of the best primary preventative practices is Dr. Elizabeth Jeglic. Dr. Jeglic is a clinical psychologist and expert in sexual violence prevention. She is also a professor of psychology at the John Jay College of Criminal Justice City University of New York. And if that isn't enough, Dr. Jeglic is also the author of Protecting Your Child from Sexual Abuse and Sexual Violence. And she is an associate editor of the journal Sexual Abuse and blogs for Psychology Today on sexual violence prevention. Dr. Jeglic, thank you for joining us today.
Thank you so much for having me.
Now, I think before we start talking about prevention, we should take a moment and identify what sexual violence truly is. I mean, some of it is very obvious, but we know sexual violence occurs on a continuum, escalating in severity. And many times we don't recognize it until we see the most egregious forms. So what constitutes sexual violence and abuse?
That's a great question. So sexual violence and abuse occurs when someone forces or manipulates another person into unwanted sexual activity without their consent. So obviously on the more severe end of the spectrum, we have rape, sexual assault, child abuse, child molestation, and incest. It can also involve unwanted sexual contact or touching, sexual harassment, having somebody expose themselves to you or watch you when you're disrobing without your consent. It can also involve instances of sexual behavior where you're feeling pressured, such as coercion. So there is, as you noted, a big spectrum as to what constitutes sexual violence.
Now, when we're putting together our prevention plans, a term we hear a lot in sexual violence prevention is evidence-based. What does that mean, and why is it so important that we use evidence-based programs in our sexual violence prevention efforts?
It's really important that we look to the programs that we're developing and look that they have data supporting them. So largely evidence-based means that there is data supporting it, that it's not just based on theory. Oftentimes, we require that these studies that are done have a control group or a group of individuals who are not given the intervention, and then we see if the intervention makes a difference, and factors that are both associated with sexual violence and also sexual violence outcomes, such as decreases in rape, child abuse, things like that. And we want to make sure that they've been repeatedly tested using standardized procedures and generally in different settings. Oftentimes, we'll test something in an ideal environment, but then when we take it out to the community, it doesn't work as well. So we want to make sure that whatever we're doing is working across a wide variety of environments as well.
All right, so let's start focusing on sexual violence prevention efforts, especially as it relates to college campuses, because we know women in that demographic tend to be at highest risk. So bystander intervention is one of the most commonly implemented forms of primary prevention. How does that work, particularly as we expand it across the socio-ecological model?
So the Bystander Intervention program has been very popular, and we're seeing a lot of those implemented on college campuses. And it's really engaging men and women as witnesses to sexual violence. It teaches them how to intervene safely and pro-socially in situations that involve sexual assault, sexual harassment, or other forms of sexual violence. So it kind of gives a larger safety net for victims. And so we want to make sure that we are increasing community members' awareness and knowledge of the problem, and then teach them how to identify when something is a high-risk behavior, and then how to intervene safely so that they can then hopefully prevent somebody from, experiencing sexual harassment or sexual assault. And in terms of the continuum across the community, we are doing that on the individual level in terms of, teaching these people when they come into college. But then we're also working kind of on the relationship level where we're doing a lot of this training in dorms where we see, some of the sexual violence happening. And then across the college community by just changing norms and talking about these kinds of models and the way that we are addressing, gender inequity and sexual violence prevention.
We're speaking with Dr. Elizabeth Jeglic, a clinical psychologist and expert in sexual violence prevention. Dr. Jeglic, the Prevention Institute has identified several societal norms that can exacerbate sexual violence, including harmful norms about masculinity and femininity, norms that support abuse of power, tolerance of aggression and violence, and sexual violence as a private matter rather than a public concern. Can you give us some examples of how these norms manifest and what we can do to start changing them?
Sure. So, we have things such as like sexist jokes or statements that people say, and they say, "Oh, I just meant that as a joke." And, language has power, and the way that we convey to other people kind of shows underlying beliefs, using derogatory names for people, for women, for people of different gender identities. Anytime that we have sexism, racism, homophobia, that degrades a person and treats them as something less than, and so it increases the risk for sexual violence. Anytime that we have objectification of women. And so we also see, what's now being called toxic masculinity, where you have men who are being reinforced for, degrading women and issues of power and control. So what we have to do as a culture and as a society is kind of reinforce that those things are no longer acceptable. We have to, kind of as we talked about in the bystander interventions, identify these as being problematic and call them out. So if you hear somebody making a sexist joke or statement, say, that's not cool. And so by changing the norms and the language that we use, we are then going to work towards changing the culture so that we can have a world that's free of sexual violence, hopefully in the future.
In the CDC's technical package to prevent sexual violence, one of the recommended strategies is to create protective environments. What are some of the ways college campuses can create these environments to reduce the threat of sexual violence?
So one of the things that they can do is hotspot mapping. So identify areas on campus that where they have increased rates of sexual violence, and make sure that there are video cameras and people or safety personnel there, so that they are identifying protecting individuals who might be at risk during those times. You also want to have safe spaces so that people can come and talk and share any fears that they have. You want to strengthen and enforce policies and reporting on and off campus, and partnering with different community organizations to help kind of support individuals who have experienced sexual victimization so that they don't experience it again and can recover more effectively.
So let's take a moment and talk about consent. It seems like it should be fairly straightforward. Either someone agrees to sexual activity or they don't. Yet there seems to be some confusion about what constitutes consent and what doesn't. How can colleges, and really for that matter, other institutions, create a culture of consent to reduce sexual violence?
I think, really is just talking about it and explaining what consent is. I think that there's a little bit of, a misunderstanding as you kind of put it as to what consent is. So consent is an agreement between individuals to engage in sexual activity. It should be, it's a lot about communication, so it should be communicated clearly and freely. Ideally, it should be communicated verbally, so there's no misunderstanding. But we also have to know when consent cannot be given, which I think is really important. So anybody who is underage cannot give consent. If somebody is intoxicated or incapacitated by drugs or alcohol or asleep, they cannot give consent. If they're unconscious, they cannot give consent. And if somebody is kind of forced to or coerced into engaging in sexual activity, that is not considered consent. Also, we have to think about unequal power dynamics. So, when it's a boss and a subordinate, or a student and a professor, that could involve elements of coercion, and so that is not when consent is freely given as well. So we have to make sure that we are understanding and thinking about all those things, and we're really working towards a culture of affirmative consent, where yes means yes, as opposed to the absence of no means don't engage in it. So asking a person if they want to engage in it, getting that verbal consent, and also understanding that consent can change at any point during the activity. So just because a person initially said yes doesn't mean they can't change their mind. They can consent to one part of the sexual activity and not to others. And we're really reinforcing enthusiastic consent and having those kinds of, trainings and discussions on campuses, having signs in college dorms, talking about what consent is and what consent isn't, I think will reinforce it. And we want to reinforce people for practicing that. So we're moving towards that, but, some states have now legally mandated it. We will see more of that in the future.
And I think sometimes people think or make the assumption that, well, you're in a relationship with that person, so consent is just implicit across the board. So it's kind of just open house all the time. And that's not true. Just because you are in a relationship or had been previously doesn't mean that you're giving consent.
Absolutely. That's such an important point. Even couples who are married, that doesn't imply consent. So you always have to ask, regardless, even if you've had sexual relations in the past, even if you've consented to those types of activities in the past, that doesn't apply consent in the moment. So being in a relationship, being married, having done those behaviors previously does not imply that you are currently consenting to them. So consent should always be gathered at each point in time.
Dr. Elizabeth Jeglic, as we start to wrap things up, is there anything else in the emerging evidence in sexual violence prevention that colleges, campuses, faculty, staff, students, that they should know when they're putting their prevention plans together?
I think you really need to think about it from that socio-ecological model and looking at all those different levels and making sure that you're addressing each one of those. And some of the new emerging evidence that's coming up is empowerment self-defense for women. It's some of the, we're getting really great results looking at teaching women self-defense strategies, but also empowering them and teaching them how to respond to various situations. In a randomized controlled trial that they did in Canada, they found significantly less sexual assault 1 and 2 years following interventions with women who participate in these types of interventions. So look for that. I think we're going to be seeing more of those types of interventions coming in the future.
All right, Dr. Jeglic, thank you so much for sharing your expertise with us.
Thank you so much for having me.
This has been Prevention is Now. I'm Deb Bonner, preventionist and community advocate for Prairie Center Against Sexual Assault. If you would like more information on this program, you may call our offices at 217-744-2560 or send me an email requesting more information at dbonner@prairiecasa.org. Prairie Center Against Sexual Assault supports children and adult survivors of sexual violence through counseling and legal and medical advocacy in 11 central Illinois counties. We also offer bystander intervention training with bringing in the bystander and coaching boys into men, and we offer sexual harassment prevention training for business and organizations in our area. Our main office is located in Springfield, Illinois, with satellite offices in Jacksonville and Taylorville, Illinois. You can find out more about our services at our website at prairiecasa.org. This program is supported by a grant from the Illinois Department of Public Health and the Illinois Coalition Against Sexual Assault. Points of view or opinions contained in this program are those of Prairie Center Against Sexual Assault and our guests and do not necessarily reflect the official positions or policies of these grantors. Thank you for listening.